Good evening, everyone. I'd like to call to order the December 21st, 2021 Community Mental Health Full Board Meeting. We will start with the Pledge of Allegiance. Please rise. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next, we will have the reading of our mission statement by Selena.
Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Next, I will move on to adoption of the agenda. I'll seek a motion to approve.
Support.
Motion from Donna, support from Lori. Questions, comments on the agenda? Seeing and hearing none, all in favor signify by saying aye. Aye. All opposed? Agenda is adopted. Next is hearing of the public. Anybody from the public wishing to speak? You have 5 minutes. Give us your name and address on any item that's on the agenda. Anybody from the public? There's also a second round later where you can speak on any item. All right, nobody's jumping up, so we will close the hearing of the public. Move on to item 5, minutes. Approval of the minutes of the Community Mental Health Full Board Meeting on November 23rd, 2021. Take a motion to approve.
So moved. Support.
Motion from Dana, support from Donna. Questions, comments on the minutes? Seeing and hearing none, all in favor signify by saying aye. 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 All opposed? Minutes are adopted. Next is item 6, approval of standing committee meeting minutes recommendations. Approval of the minutes of the Community Mental Health Board Program and Budget Committee meeting on December 8th, 2021. I'll take a motion to approve.
Motion to approve.
Support.
Motion from Ryan, support from Selena. Questions or comments on those minutes? Hearing and seeing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Meetings are adopted. Next is item 7, request to approve. We did some of these items in committee, so I will look for a motion to approve items 7A, B, D, and E.
So moved. Linda.
Support, Ryan.
Motion from Linda, support from Ryan. Any comments or questions on any of those items? We're excited to approve Dave's contract. Dave's excited too. Hearing and seeing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Next, we'll move on to item 7C, request to approve voluntary special assessment. Selena?
I make a motion to move this to program and budget in the January session so that we have more time to further discuss it and to look into a few things.
Is support from Dana. Any questions or comments on moving this to next month? I know Dave's
I have a
been...
question.
Sorry, Linda, go ahead.
Dave has some more information and sent us information today, but if you have specific concerns, there is a time parameter on that's being accomplished, so that we don't have to drag it out at the next meeting, just make known what your questions are, so people can be prepared to provide the answers.
Thank you, Linda. Yes, any questions you want to ask of Dave, myself, anybody on staff, please send them in an email ahead of time so we can have the team prepped and ready and to answer those questions either ahead of time or at the meeting. Questions or comments on moving this item to January? All right, hearing and seeing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Next is item 7F, which is a new item, MDHHS Suicide Lifeline Capacity Building Grant 2022, Amendment 1. I'll take a motion to approve.
Support.
Motion from Selena, support from Lori. Dave, Adam.
I can delegate down.
I tried.
This is one of the EGRAMS
contracts that comes through the state's egrams data system. They were a little off with this. It's one of the smaller grants for just over $25,000. We do participate actively in the statewide suicide lifeline, and most likely this will be transitioned in future years to the MyCal, but for now that's what it is. We're part of I think there's about 5 regions in the state that answer some of the overflow calls for the suicide hotline.
Questions, comments for Dave? All right. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 8, receive and file. We have no items there, so we will move on to item 9, resolutions. And I'd like to take these one at a time. We do have 1 or 2 folks in the audience here, and some of these people we've had for a very long time, and I want to give them the recognition that they very much deserve. So I will take a motion for a resolution for Lori Value.
Move to approve.
Motion from Linda, support from Lori. Anybody want to? Tracy's going to come up and she's going to hang out up there for a little while.
So most of you would have know Lori from the CAC, so you have a lot of exposure to her, and she's come up here and presented to you. Her last day is January the 21st. You will notice a pattern as we announce these. There's either the 7th or the 21st coming up. She's actually been with the organization the longest of everybody who we're presenting tonight. It's 27 years. Her current job title is Local Hearing Coordinator, but she's held several positions in customer service and marketing and several other areas. So I know that we do have one person here, but not everybody, for obvious reasons, either wanted or could come, but I'm sure they're very appreciative. Lori will have a virtual party for her coming up, so as we get that information, you'll see it shared. So if you ever want to attend, you are absolutely welcome to do so. There is actually live events, too, that are being held, so again, we'll share those. We kind of went with the preference of whoever it was honoring.
Thank you. Anybody have any comments about Lori? All right. We have a motion. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 9B for Bill's in the crowd. Take a motion for Bill Dragna. I hope I said your last name right.
Yes, you did.
All right. Motion
Donna.
from
I've known
Linda.
Donna
Hold on one
longer than
sec.
any other person in this whole room. Or any other person in our organization, literally.
Just a couple of years, right, Bill?
Just a couple of years. I couldn't even tell you how long ago that was, but it was when I was with the ISD.
Bill, let me get a motion real quick. Linda, motion, is there support? Support from Selena?
Support it.
All right, we'll let Donna support it. You got that, Linda and Donna? All right, Bill, go ahead.
Okay, I didn't really come thinking of giving a speech, but I found this last couple of weeks here, I had a virtual retirement party, and then we had our last strategic planning meeting, and I didn't expect that to be an emotional thing for me, but it was. And then when I walked in and saw Donna, and I thought, oh, what's going to happen again? But I know not all of you know me, and I know quite a few of you do. It's been a long career here, and I've really enjoyed it. My reasons for retiring are mine and my wife's, and they're completely outside of this place. But I've loved the job. I've loved the opportunity to work here, and did what I did for the years that I could. So I want to thank you all, especially of those that know me. And even the ones that don't really know me, thank you too.
Thank you, Bill.
Thank you, Bill.
And thank you, Dave and Adam, and Tracy.
And I just
Donna?
want to say, if you don't know Bill, I'm sorry, Donna, for interrupting, that one of his best qualities, and I think he would agree with this, is he is a good human being. And what I mean by that is, you say we used to get like teary-eyed, he does that for other people. Like, he really does have a good heart for the services we provide. Although he was in IT on a regular basis, his motives and his intentions at all times were to do the best for the people that we serve. So it was a true honor to have him be here.
Thank you so much.
Thank you, Bill.
Donna, go ahead.
Well,
Turn your microphone on,
Donna
Donna.
and I first met each other at Neil Reed High School, and we did great service together. with severely emotionally impaired kids. And we had great times there, didn't we, Bill?
Yes, we did.
Lots
And
of fun.
that was a job I loved
Yeah.
because I was
Both
working
loved
with the
it.
people.
Yeah.
And my job didn't get to work with those people the same way, but I still loved that job as well.
And then I shattered my foot, unfortunately, and was on a walker and really couldn't cross being there for obvious reasons. I was walking on a walker for about 6 months, and they pulled me into First Southeast, and I missed Bill, and one day I happened to see Bill, as fate would have it, working for our organization. So I was like, wow, fate has brought us together again. So we've known each other, I think, probably 30 years.
Probably.
Probably 30 years. And the one thing about Bill, absolutely, he's got a heart of gold. So it's been wonderful knowing you. You're one of the most brightest lights I've ever known in my life. So I'm sure that fate will bring us together again.
I'm sure it will.
Have a wonderful retirement.
Thank you so much, Donna.
Thank you for your service all these years.
Thank you.
Thank you. We've been blessed.
Thank you, Donna. Anyone else? All right. Thank you, Bill. We have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is a resolution for Cindy Conal. Take a motion to approve.
So moved. Support.
Motion from Donna, support from Linda, I think. Yes, good enough.
So Cindy Conor, you guys have all met too. She's presented. Her most recent job title was a Chief Quality Officer, but prior to that, she had 21 years experience with CMH. And while in those roles, she played everything from a therapist to an administrative assistant to an administrator and all the way up through managing several departments, including managed care, and again, her most recent one overseeing quality. Cindy is retiring also the 21st, again, the pattern. She is having a live event, and we're going to try to offer at that live event for somebody just wants to do virtual, they can do that. So we will share that information as it comes along. I believe it's actually on the 21st. So we will share that there. And Cindy will be greatly missed. We're very fortunate. She cares very much about us, so she told us way ahead of time. So we've been transitioning over the last couple of months, doing our separation anxiety and also making plans.
Any comments on Cindy? All right, we have motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next, I'll take a motion for the resolution for Patricia Willis.
So moved. Support.
Motion from Selena, support from Lori.
Patricia, or Pat, is a therapist, and believe it or not, she was hired 21 years ago. Yes, 21 years ago, as a therapist in OBRA. She's actually never left the OBRA department and is the longest standing individual who works for that particular department. And I'm sure it's well known by that organization, and she takes a great lead in it, and she will be greatly missed. She is also retiring on the 7th, and she is not having a big whoop to do. That was her preference, but of course the local office is going to be celebrating her and acknowledging her. On all of these, we do have actually draft resolutions, so you will see them, and we'll tell you a lot more about the great accomplishments that they have. But of course, she will, of course, be greatly missed.
Any comments from board members? All in favor signify by saying aye. Aye. All opposed? Motion passes. Final resolution is for Gail Parker. Take a motion to approve. Motion from Antoinette.
Support.
Support from Dana.
Gail, you will see if you've never met her in tomorrow's workforce update. This does encompass why she's in it. It does encompass who she really is. She's the winner for, is it collaboration? Collaboration, I was trying to remember which one. Our core values are collaborative, accountable, and respectful. So she was nominated by her peers as exemplifying the core value of collaboration. So you'll see her picture. She won an award. She's going to get a lovely professional letter from Dave, and a gift card, so you can see her there. But on that same day, she also won a ham, and she won one of her things. So she joked around like I should go to Vegas today, because she was definitely a big winner. Gail literally embodies not just the core value of collaborative, but everyone you ask. We did a mock election probably about a year ago of like who exhibits the core values, and she was nominated the most and in all categories. So she's actually a office assistant at the West location. She's very quiet, and you would never know, but she makes a huge impact on that location and is one of the most pleasant people you will ever meet. So she will be greatly missed. She's been with the organization for 11 years, and she has always held the position of an office assistant. She has been in different programs, but always as an office assistant.
Thank you. Any comments? All right, motion and support. All in favor signify by saying aye. Aye. All opposed? All of the resolutions are approved. Thank you to all of those longtime staff members. We have a lot of holes to fill, but thank you all for your service. Next, we'll move on to the voucher listings. I'll take a motion to pay the bills.
Motion to pay the bills, support.
Motion from Lori, support from Selena. Questions, comments on the bills? All right, all in favor signify by saying aye. Aye. All opposed? Bills are paid. Next is the management report. We will start with the CFO update. Richard is not available, so Ken is.
Ken is here.
Take it away, Ken.
I will do my best Richard impersonation, so hopefully I don't let him down. I'll start with the monthly finance report. Everyone should have a copy of that. Starting on page 2, we have our revenue and eligibles. These continue to be very high. We expect that revenue and eligibles, the state of emergency is continuing to be extended. There doesn't appear to be any particular end in sight. So revenue will remain high into fiscal 22 is what we're projecting. Flipping over to page 3, some of the bar graphs that stick out here, you can see at the top our assets, we have quite a bit of cash. That's a result of the high revenues as well. If you go to the next table, liabilities are also high, and you can think of those as offsetting probably because we owe quite a bit of that back to the state. So before I go any further, I will preface that these are year-end September 21 statements. They are projections, the best estimates we have, but they are not audited. They're not final yet. All that will occur in the February or March timeframe, depending on when the FSR ends up being due. We skip to page 4. Again, we can see in the top graph there, revenue, capitation revenue maintains high. Expenses for the year up a little bit, offsetting some of that revenue. And our net income at the bottom is projected to go up as well. Page 5 has some budget to actuals. We're favorable in almost every single category here. Again, revenue continues to be high. If we go to page 6, detailed balance sheet here, but there's not much change from prior months nor anything that jumps out compared to the graphs. Page 7, we added a new line to the report in this particular month to kind of encapsulate on a monthly basis what we expect the estimated lapse to the state will be. So you can see, second line down there, we have the Medicaid HMP GF lapse to the state is almost $70 million for fiscal 21. The breakdown of that is $65 million for Medicaid / Healthy Michigan and $4.5 million for GF. So again, those liabilities are reflected in these statements, and we're going to owe those dollars back to the state. As a result of the continuing projection of high revenue, we had discussed bringing the idea of a rate increase to our providers, the rate increase being 6.67% effective January 1 of 2022, sorry. That number might seem kind of random, but it was intended to be a 5% increase for the entire year. Because we're already partway through the year, we adjusted that to effectively give a 5% increase over the entire year, but just for those 9 months. So I think that'll help providers out a great deal. It's an across-the-board rate increase. We project that that will cost roughly $10 million, which we have budgeted in our contractual services line, so there shouldn't be an issue from that perspective. I will be happy to answer any questions or research any questions if I don't have an answer right now.
Linda?
Well, I just have a question. I don't know if this is the place for it, but at our last, this is full board, at program and budget, someone from the public, a provider, came and asked us as a board to be aware of the disparity between Oakland and Wayne and what Macomb pays. And then after the meeting, I had some conversations with her too, and I still think that we need, I didn't get my answers, and I still think that we need some kind of conversation either in a work group to explain to us what the difference is in the two counties. Is it an economy of scale? Is it, I don't even know. So, but I think that needs to be addressed, and the board needs some educational sessions on that. And even with the 5% or the 6.67, does that bring us up, even par with them, on par with them, or what? So maybe in a work group, Dave, or some way, if other people have the same
We
need.
did, yeah, we met with Ken and Christina, and I met with the Provider Alliance folks, and we heard additional detail. We had been doing a lot through the provider stability, but it was not, some providers were not able to participate in that. So we did look at the rate increases. We know the total annualized amount, but we will look at specific services, and we can do a comparison. We have access, the state, it's the Milliman Drive software. It's a little behind in the, we don't get current information. It's at least one fiscal year back. But yeah, we can find some numbers and do a comparison.
Thank you.
Ryan?
Yeah, I agree with everything Linda just said, and I remember that person that came to speak to us. One thing I would like to see in addition to Oakland and Wayne, I wonder what other counties are doing as well. They might not be comparable, I understand that, but just to see a bigger perspective. I mean, I could see maybe St. Clair or Washtenaw, I don't know, but maybe they're not comparable to ours, but I think the more information we have, the better, so that's all.
Thanks, Ryan. Anyone else? Questions, comments for Ken or Dave about our financials?
I have another question.
Linda, go ahead.
The lapsed amount is different than I thought we were told. Is that a new figure that we didn't know about before?
I think
That's
it's,
for 21, right?
yep, that's for 21 for the whole year. I think it's just reflective of that ever increasing revenue number. So we've done we've had different programs and things to try to effectively expend some of those funds. But yeah, that's the estimate as we stand now. I expect it to go down slightly just as more claims start coming in, and we're paying those out throughout November and December. So this was I think mid-November report. But
And you get a question because you added the line. I do appreciate you adding the line, but.
I think it provides some context on a monthly basis, so you can see the revenue received and then that kind of offsetting amount. So hopefully it helps going forward.
Thanks, Linda. Anyone else? All right. Thank you, Ken. Have a good Christmas. Appreciate
Yeah,
the
happy
report.
holidays to everyone.
Thank you.
Next, we will go to Dave for the CEO update.
Good evening, everybody, and happy holidays. But Touching on that too, we had the board work group on the new programs. We had a good response, but now we have to go back and dot the i's and cross the t's. So we are working, Christina's our point person, on, we're building off of our single case agreement format for those contracts, and we'll be adding those program descriptions so that we can start getting that money out the door and encouraging, supporting those programs that we felt were important going forward. I did hear from Christina and Adam too. We did a RFP. We will be bringing on some new providers as well to help with the capacity. We're focusing a lot now on it's the DCO agreements, which are the designated collaborating organizations under the CCBHC demonstration project with the state of Michigan. So we need to get those agreements up. I've been describing it, I said, like in my simple mind, we have a network of providers for the behavioral health. We have a substance use network of providers. We're going to have a third network of providers who are providing the services under the CCBHC, and they'll have separate contracts and a different payment mechanism on that side as well. So our network is expanding. I shared the article that Mork and Easter seals are merging over this fiscal year. The plan is to have them with the joint name, I think Easter seals Mork, as of October 1st. We did get the update from the Community Mental Health Association. There was no activity by year end on the Shirky bills, which was a reprieve a little bit. So things are kind of on hold until the new year. We continue to track and follow that. Tracy touched on some of our holiday activities. Just wanted to publicly thank all of our staff who were involved in the organizing and planning of those events. I was able to attend some of them. They had a Christmas trivia. We had the on-site party there at our West location where we were able to give out those awards to staff. Again, it was, trying to do the best you can given the limitations we have for this holiday season and stuff. But overall, very well received and very appreciative of those efforts. We did meet as a region, the Tri-County. I think we're using the tagline now, Tri-County Strong. There was an emergency funds that became available. I received information today that they were approved at the federal level regarding the flooding that took place in the Tri-County area. So that collaboration was, they were calling themselves Tri-County Strong. We are a part of that, but we're expanding it now to include the support of children and the students and family members and educators going forward. So we did have a follow-up meeting, and we are planning regional efforts going into the new year. So I'll keep everybody updated on those. We're going to be building off of the Surgeon General's report about kind of the state of mental health for children. And not sure if I shared that. If I didn't, I can get it out to everybody electronically. But it's very well done, and it's a good kind of starting point that we can build on. The CMHSP program grant, that's our general fund dollars. You just approved that in today's meeting. I did get amendment number 4 to our PIHP contract. I had to have that corrected with the proper signatures, but that will be coming forward to the January board meeting. It's a revenue increase of about $8 million in the middle of this current fiscal year. And those are my updates for today. Thank you.
Thanks, Dave. Questions, comments for Dave? Short and sweet today. All right. With that, we will move on to other possible agenda items. We have a couple presentations. I'd like to have a motion for receive and file for Crossroads Clubhouse update.
So moved. Support.
Motion from Linda, support from Dana. Bruce and team, the floor is yours. Thanks for coming tonight.
Yeah, thank you. Thank you for allowing us to come and kind of brag a little bit about Crossroads Clubhouse. We're very appreciative of that. I'm very excited to talk about the best clubhouse in Warren, Michigan. So, I'm sorry.
We're the only clubhouse in Warren, Michigan.
Oh. Okay. Well, let me talk a little bit about the quality indicators for the only clubhouse in Warren, Michigan. Thank you, Teresa. Crossroads Clubhouse, we began tracking specific data called quality indicators to summarize in an easy-to-see graph of all of our activities at Clubhouse. They use quality indicators mirror data that is tracked by Clubhouse International. It'll also be included in the Flourish database for clubhouses that's going to roll out in 2022 and is available to community partners primarily as a marketing tool for anybody that wants to know more information about Clubhouse in Warren, Michigan and some of the outcomes. These indicators fully embrace the 37 standards, and with that, one of the things that we decided was that it was probably best for our membership to present these quality indicators to you. So I have with me my friend Teresa Miller and somebody that you've probably met a couple times, once or twice, Mr. Ray Dewhurst. So I'm going to turn it over to them.
This is a summary of the 2020-2021 quality indicators. Attendance. Average combined hybrid daily attendance was 28 members daily. Average daily in-person attendance, 10.81. Note, for most of the year, Crossroads was at a capacity of only 40% or no more than 12 members on site to provide a healthy and safe reintegration of our clubhouse community in this new norm as a result of the pandemic. Additionally, Crossroads took a pause for 3 weeks in November of 2020 at the recommendation of Governor Whitmer. Average monthly virtual attendance, 17.58. Members were physically in the clubhouse 2,615 times for an average of 5 or more hours daily. Members were actively involved in Crossroads work order day 2,986 times.
For the last fiscal year, Crossroads has had 2,049 responses to the Happy or Not kiosk with a happy index of 96%. Next year, we anticipate it to be even higher. Crossroads was awarded the first annual CMH Smiley Award.
New membership. Crossroads provided 37 tours with 20 new members. 54% of the people who came for a tour of Crossroads became members.
Crossroads prepared 2,978 home-cooked meals for members during this period and gave 117 free meals to celebrate members' birthdays or other membership special occasions, for example, new employment or education achievements. Also, Clubhouse celebrated all major holidays on the actual day with each a lunch or a breakfast. For example, Bruce will be hosting breakfast for members on Christmas morning at Clubhouse.
So feel free to stop by if you want for breakfast on Christmas morning.
Hospitalizations, a ratio of 0.5 Crossroads active members were behaviorally hospitalized monthly for an average of 4.33 days, in comparison to one Crossroads active member was actively medically hospitalized monthly for an average of 8.76 days.
83% of Crossroads Clubhouse members voluntarily reported that they were vaccinated against COVID-19.
Reach out. Crossroads has sent out 752 cards that include members, families, community partners, and CMH staff. 1,080 newsletters mailed out. Here's the big number. Over 5,580 newsletters have been emailed to community supporters of Crossroads. Crossroads has 353 social media followers, and I can tell you, I help run the social media. It rises by 2 or 3 people a week. Crossroads has a total of 9,659 positive documented reach out contacts for this period of time. And finally, Crossroads participates in community-based events to promote Clubhouse and advocates when necessary, like the Michigan insurance video that was produced starring Teresa and myself.
Employment. During the last quarter of 2021, 43% of the current active Clubhouse members were gainfully employed in either transitional, independent, or supportive employment. During the pandemic, Crossroads has gained 6 transitional employment positions for members. This is more than any clubhouse in Michigan. Crossroads staff has also provided 323 hours of on-site transitional employment support and 10 hours of supportive employment to members.
Education. 50% of Crossroads membership express interest in improving basic reading, writing, math skills, or getting their GED, getting their technology or culinary degree. On average, 9 members per month participated in the Employment Education Committee meeting.
Housing. 2 Clubhouse members reside in our Crossroads Clubhouse housing program, and there is discussion to expand that.
Wellness. 48% of Clubhouse members participate in the wellness program, which includes a daily 1-mile fast-paced wellness walk, or chair yoga, meditation, or healthy diet planning in the food service unit. Total time for wellness walks, 188 hours.
Social recreation. Crossroads provides 55 social recreational activities with an average of 17 members participating each time. And Crossroads would like to wish you all a Merry Christmas and a joyous New Year, and we hope to see you soon at Crossroads.
Wonderful job.
Thank you.
Does any board members have any questions or comments for Bruce and his team?
That's a lot of data.
Donna, go ahead. A lot of numbers. Donna, go ahead.
Yeah.
I just wanted to say back to all of you, absolutely unbelievably marvelous job. I just want to say, I can't believe the numbers, just unbelievable. And I want to say Merry Christmas to all of you. You did an absolutely great job. I'm just blown away by it. Thank you.
Thank you so much. Thank you so much.
Bruce, you have an event tomorrow?
We do. We have our annual Christmas party happening on site. That's going to start at 12:30, go till about 2:30. We're also doing White Elephant gift exchange. I heard that somebody that's dressed similar to Santa Claus is going to be there.
Apparently, from what I understand, he is not going to be in his normal Santa Claus outfit. I guess he's going to scale it down a little bit, but we're having a party tomorrow. And like I said, I'll be there on Saturday morning making breakfast for Clubhouse members. Whoever wants to come and spend the morning with me, we'll all be there together. That's our extended family, and we look forward to spending that time together.
Pretty nice. Merry Christmas, you guys.
Thank you.
Merry Christmas.
Merry Christmas.
Yep, Merry Christmas. Anyone else? I just want to thank Crossroads and Bruce and the whole team. I was there when the Attorney General came for a visit, and she stayed a lot longer than I expected her to. But it was a great tour. Angel gave us a tour. She was a fantastic tour guide. I know she's well trained. But to everybody there that was there, it was a fantastic visit, fantastic tour. I think our message was loud and clear to the Attorney General, who claimed she was going to pass it on to the governor that evening, so hopefully that happened. But I just want to thank all of you for what you did. And that Smiley Award, the major award is right there in the office right when you walk in there, so congratulations to you guys for that. Keep up the good work.
Thank you.
Thank you.
Happy holidays.
All right, we have a motion to receive and file. All in favor signify by saying aye. 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 All opposed? Motion passes. Next, we will bring up Lindsay from CARE. I'll take a motion to receive and file. All right, motion from, I think, Donna, support from Antoinette. All right, now, before you get started, Mark always talks about how he likes to keep everything separate, but I opened this folder, and he's smiling at me.
Whoops. That was supposed to be in the back.
Just all right, enough of that. Go ahead, whenever you're ready.
Thanks. Hi, everyone. My name is Lindsay Parton. I'm the program supervisor at CARE Recovery United Community Center. I'm a person in long-term recovery. What that means to me is that I've been sober, completely abstinent from all drugs and alcohol for 7 years. Thank you very much. So yes, I know you're all very familiar with CARE of Southeastern Michigan and Mark Kilgore. We get him full-time while you only get him some of the time. Lucky you. Just kidding. I had to do a dig. No, we love Mark. Okay. I want to start by thanking you for the opportunity to come here tonight to speak on behalf of Recovery United Community Center. Because of all of your individual efforts and your efforts as an agency, we are able to make a distinct impact in Macomb County. The Recovery United Community Center's mission is to build an authentic connection of hope, recovery, and community through meaningful relationships and profound advocacy. Recovery United is a beautiful new community center located in Fraser, offering free services to people seeking, living, and supporting recovery. We are open to the public. Anyone can instantly be connected to a recovery environment just by walking inside. Only the RUC offers the highest standard of peer recovery coaching services. We are CARF accredited. We use evidence-based, person-centered practices. The RUC is home to over 40 peer recovery coaches who are certified either through Michigan Certification Board of Addiction Professionals or as certified peer recovery coaches through MDHHS. Our coaches work with anyone seeking recovery from substance use disorder, and our data shows that 51% of individuals admitted into peer recovery services had a positive service outcome upon concluding services. It's not hard to see that CARE is the leader in peer services. As your preferred provider, we will not stop fighting for full access to services that will aid in the substance use epidemic. Currently, we have a program for everyone, and everyone has access to a CARE peer recovery coach. We are living our mission. Okay, so it's not my preference to talk about myself. It makes me a little uncomfortable, but I do believe it's important that you all know the kinds of people that work for CARE, who are committed to CARE, and how we individually impact our community through the resources that CARE provides. So last year, 2020, October 28th, it was my 6th recovery anniversary. It was a Wednesday, and I just got off work from the RUC, and I took my normal route home. I got about 2 minutes from home when traffic came to a standstill I thought we got stuck by the train, but I couldn't see what the holdup was. And then traffic started to slowly move again, and I finally pulled up to a scene of a car pulled over in the right lane. The driver door was open, his head was back, jaw dropped. He looked to be unconscious. There was another person standing near the car on a phone, and I immediately knew what was happening. Because of various life experiences, I know what an opioid overdose looks like. And because I work for CARE, I carry Narcan in my car as part of my first aid kit. I passed the scene slowly, gathering information and watching as onlookers do. And once I passed, I pulled over safely into the next business driveway. I parked my car, I grabbed my Narcan, and I literally ran back to the traffic scene. I walked up to where the driver was, tried making a connection, calling out to him, but there was no response. I noticed a syringe on the floor of the car, and I knew. I opened my Narcan kit and administered one dose. About a minute later, there was no response from the victim. I administered the second dose. And as I continued to try and make contact, the man began to flicker his eyes, and I saw him breathing. That's when the police arrived, and I was able to explain what I believe happened and told the officer that he may need another dose of Narcan. Seconds later, the driver was conscious and alert. He even stood up, and I walked to the sidewalk and stood back. Ambulance showed up and began giving the man medical attention. He was alive, thank God. Because of the Narcan training I took through CARE and all my experience training others, I was completely comfortable in this element to administer Narcan. His life was saved. It is a must, though, that I tell you that every other person working at the rec has a similar story to tell. Because we believe that CARE isn't just a clever title, it's the way we approach the people that we serve. We are agents of saving lives. Whether it's through Narcan administration, sitting with people in their pain, judgment-free, or connecting someone to a resource that is vital in their mental well-being. We do it all, and we're honored to do that. CARE is unique, and our value lies in our fundamental goal, to ensure that any person who is in need has access to free, supportive resources. We want to save lives in order to enrich and empower our community. The Macomb County Medical Control Authority reports a 23% increase in the use of naloxone, commonly known as Narcan, by emergency medical technicians during responses for the first 3-month period from May through July 2020 compared to the same time frame in 2019. We know that this has been a steady problem in our county and region. CARE was quick to respond and began our outreach program in 2019 in partnership with Macomb County Sheriff, MedStar, and Chesterfield Police Department, making up our Overdose Response team. The team of a peer recovery coach, paramedic, and police officer meets with opioid overdose survivors at their doorstep within 72 hours of an overdose where Narcan was given. And through our peer recovery coaches, the survivors are instantly connected to ongoing support to begin and continue their recovery journey. Since we started our program in 2019, we've distributed over 4,000 kits of Narcan in Macomb County. We also have peer recovery coaches in every hospital and emergency department in Macomb County. We are part of the team there and meet with anyone coming in the emergency room who has overdosed, is experiencing withdrawal or was intoxicated, or even mental health patients with identified SUD. Assisted by the PRC, 58% of people we met with in the emergency room go to residential SUD treatment directly from the ER and are followed up with by their coach. We also have coaches at Ascension Ross and Beaumont Royal Oak. We have peer recovery coaches in the 40th, 39th, 37th, and 16th District Recovery Court systems. And we have a coach working in Macomb County Jail and several prisons across Michigan. Because of all of you, we've been able to enhance our services through a SAMHSA grant. If you take a look in your folders, there's an array of flyers highlighting the different programming that we offer at our center. And we know through our partnership that community mental health takes its role very seriously in protecting the systems that serve our community. We are funded by MCOSA for our center and services, and our value is that we provide every service for free. As the program Supervisor, I'd be honored if you all would join me and my colleagues for a private tour of our center and presentation of how we are impacting the community that we serve together. Thank you.
Thanks, Lindsay. Nice job, and thank you for sharing that story.
Yeah.
Incredible story.
Thanks.
Any questions or comments for Lindsay about CARE, so we'd never have to ask Mark any questions ever again?
Yeah, please. My card is also in all of your folders, so if you want to reach out directly, feel free to do so.
Thank you. I don't see any questions or comments, so thank you very much.
Merry Christmas.
Well,
We had a
Phil,
motion
you know
to
I have a
receive.
comment.
Mark, go ahead. I was trying to kill time so you'd get going.
I just want to make a comment. That story that Lindsay shared, she immediately picked up the phone and called me. She was so excited she was able to save that person's life, and I don't know who was more hysterical or emotional over it, me or you, but it was really cool though. She called me just so excited that, you know, and it was on the anniversary of her 6th year of being drug and alcohol free. I'm getting teary-eyed right now.
Thanks, Mark. All right, we had a motion to receive and file the presentation. All in favor signify by saying aye. Aye. All opposed? Presentation is received and filed. A couple reminders for January of 2022. We will have program and budget Wednesday, January 12th here at 6 p.m. And we will have full board Wednesday, January 26th here at 6 p.m. Are there any other board members with any other agenda items? All right, we will move on to hearing of the public. Anybody from the public wishing to speak? Up to 5 minutes, give us your name and address. Going once? Going twice? Sean, you coming up? All right. We will close the hearing of the Lori. Yes, before we close the meeting. We will close the hearing of the public, but Lori, go ahead.
I just wanted to, on behalf of our wonderful secretary, office assistant, whatever, communicator, therapist, all of us on the board. Wish you a Merry Christmas and Happy New Year.
Thank you, everyone.
Okay, you're welcome.
Thank you, Sandy, for putting up with all of us for the year. Dave, you're not so lucky.
You approve my contract?
That's right, you got a contract. You guys, fair enough. Merry Christmas. With that, I will ask for a motion to adjourn. Dana and Donna. All in favor? Aye. All opposed? We are adjourned. Everybody have a good holiday, Christmas, New Year. We will see you in January.